Hi, my name is Melinda Mabbitt, and I am a Wyoming transplant, but I've been here in Brookings for 9 years. I work at SDSU, and I'm a learning designer there, so I help faculty take their courses that are face-to-face and move them online. So I get to work with faculty all day, and it's a wonderful, wonderful job. So I am actually very familiar with orthopedic surgery. In my 20s, my right knee was completely destroyed, so I had to get it almost completely replaced. So I've been familiar with it. Well, now my left knee had started hurting. And I thought, well, maybe after 20 years of dealing with this, all of a sudden my left knee's going, I'm out. I don't want to play anymore. My kneecap wasn't quite dislocating, but I'd walk on campus. I try to walk twice a day just to stay healthy, and it kept locking up. And I remember I was walking past biostress, and it locked up on me on the ice. So I called in and said, I'm probably going to need to be seen by an orthopedic surgeon just to make sure my left knee isn't going to do what my right knee did 20 years ago. I heard he was a straightforward guy, and that's the kind of person I want to be around. I don't want to be given all this fluff about, just get to the answer, tell me what we need to do, and let's move on. And that's what I heard he was like. So yeah, very personable doctor. So I thought it was going to be an x-ray, just because that seems to be standard. But the MRI is what he ordered for me, just because he said if the knee's locking up, we need to see more than what the x-ray will show. So they ordered an MRI just to see if there was anything floating in there or anything that was obviously catching the left knee. And that was actually clear. So I was happy for that. So that first initial scare was fine because they couldn't see anything bad in the MRI, which they could in the right. So just because there are areas that you couldn't really see. I mean, the MRI does show a lot, but there's places where maybe the bone's too high or maybe the joint is just not moving right. And so he said if we go in and scope it, he can get eyes on it and actually see physically what's happening with my knee and what might need to be done. So a lot of people think it's big, massive scars on your knee. It's not. That's on the right. The left has scars about this long on either side of the kneecap. One is to go in with the camera, the other is to use tools if needed. And he went in there and took a look around. There was really no issues that he could see, except for there were areas that needed to be rounded out, and smoothed out a little bit, because that was what was catching the knee, is just not that smooth transition that was needed for the kneecap. So no removing bone or anything like that, just kind of smoothing it out. But they treated me very well. I mean, I was never a number. I was never, just patient X or any of that. They treated my husband well, asked if he needed anything while I was in recovery, came out immediately and talked to him, told him what was going on so that he wasn't sitting there wondering in the room, what's happening with my wife. But they were wonderful, absolutely wonderful. And when they took me back into the OR, they said, it's a little chilly in here, but we'll get you warmed up, and they got me settled. The anesthesiologist told me what was going to happen, and Dr. Dressander was there, and they just kind of all waited for me to fall asleep. And I hate surgery. I've had to do it several times, and I always hate going under, but they made it just a very comfortable experience. I had a couple that were holding onto my arm just gently, just that touch helps a lot. So, yeah. One of the things that you always worry about with your joints is the pain afterwards, and I didn't feel anything. They always ask, after surgery, do you want to have this pain medication, limited amount of pain medication? And I turned it down. I mean, the second I came out of surgery, I didn't feel any pain. And I really didn't feel anything like that. I just felt great. I mean, my knee felt better going out than it did coming in, which is the goal. So, yeah. There is no popping and cracking in that left knee anymore. I've been walking my 3 to 5 miles a day, not a problem. The right knee we won't discuss, but the left knee, beautiful. It's working smoothly. The recovery was actually really easy. When I had my initial surgery on my right knee, I was out for 6 months. I had a knee to ankle brace for the first 4 months. So I was a little nervous. I thought, are they gonna make me use crutches? Am I gonna have to have a brace? Nope, I walked out on my own power, just a little bit of aid with, a person behind me, more because of the anesthesia rather than the actual surgery. My husband has a lifted pickup, and I kept telling myself, use the right knee first, don't use the left knee. I was able to get up in there just fine, and within 2-3 days, I was walking on my own. It made me less scared to walk. That's the one thing that I have to do. I have fibromyalgia, and so I have to move my body. And when your knee's locking up in front of biostress on campus, that kind of makes you hesitant to even get out of your office chair. And so getting this knee scope actually allowed me to get moving again. I'm a little more confident on the ice. I mean, we'll have to walk like penguins, but now I can without that knee locking up on me. So that's been probably the biggest thing, is it's just changed my ability to be free and move actively and be be involved. I was starting to slow down even with my children. I wouldn't run and play with them anymore. And that really hurt because they'd ask to play and I'd say, oh, mom's knees are not working so well today. I don't have to do that anymore. So I have a lot more confidence now that I've had it done and know that everything's okay. This knee's going to last for a very long time, he said. He did look at the right and he said, I have to have a knee replacement though. So he did, but he delivered the news graciously, because we were looking at both knees at that point just to make sure everything was working right on both sides. Yeah, don't wait. That's what I did with my right knee, and it was not fun to recover. With the left one, I knew immediately as it was locking up that something was wrong, and I didn't want to ruin that joint because nobody wants to have a full knee replacement at 40 or even 60. So if you do have an issue, get in right away and just have them look at it. I know it's scary. Sometimes you don't know what's happening with your body, but that's why the doctors are here. That's why the imaging is here and the procedures to help us get back up and moving. That I was a human being. I wasn't just a number. I wasn't just a patient. I had a face. I had a name. I had, conditions. They even asked me about my fibromyalgia and if I might need something to relax afterwards. So they were looking into my history and making sure that anything in my history that could affect how I was reacting in surgery was not an issue. I remember they asked me about whether or not I get nauseous after anesthesia, and I said, I do. They immediately went and got a patch and put it behind my ear. They told me not to touch it, but and that helped a lot with that nausea. And they just cared for me. They wanted to make sure that I was doing well. I never felt rushed, even though I slept in for a couple hours extra than they thought. They actually were just wanting to make sure that I was ready to go and ready to get up and move. And so that was really important, is they gave me the time and they gave me the compassion. But yeah, so in Rapid City, I lived there previously, and their care was great, but I was always a number. I was never Melinda. It was just patient move. And they were very strict about their timelines. And Dr. Dressander was never like that. He would always he spent time with me. He would answer all my questions. He didn't look like he was being rushed. And I know they're busy, they have tons of patients, but it felt nice that they were focused on what I needed to have done to me. They were just wonderful. Not being a number is probably the biggest thing I love about this hospital. And just, you see the people, you see the people at work, you see the people at church, and you just know, they know you, they see you, they know, hey, you're Melinda. I know you've just had surgery, how you doing? So it's very nice to have that hometown feel.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.